Welcome back to Preserve Health Talks. I'm your host, Dr. Ira Pearlstein, with my co-host, Leah again. And this morning, we're going to bring a good friend of mine and renowned psychiatrist to our show, Dr. Perry Mandanis. And Perry and I go back a long way. Perry was on my former radio show with Leanne Talton, who was my co-host then. That show was called Paradox. But Perry and I go way, way back. Our grandmothers were neighbors. Our moms were friends growing up and all through their adulthood. And Perry and I have been friends since we were little boys. And we both became doctors, and I settled here in Florida. And Perry is up in Hampton, Connecticut. Perry is boarded in pediatrics, as well as child psychiatry, adolescent psychiatry, adult psychiatry. And he's been practicing for many years in the Providence, Rhode Island and Hampton, Connecticut area. And for listeners who may be new to this show, Perry, could you briefly describe your background, or Dr. Mandanis, I'll refer to you as, your background in child, adolescent, adult, and family psychiatry, and what drove you to go into the psychiatric field?
And thanks for having me here, Ira. I really appreciate it. It's great to be with you this morning. That's kind of a long answer. I studied hard and I was a good student all through high school and college, but it was clear to me that I had to work a lot harder than my peers. So if they could do an assignment in 3 hours, it would often take me 4 or 5. And when I got to medical school, that became impossible. The assignments were too long and too difficult. I could no longer keep up. And I started thinking I had made a mistake. I should never have gone to medical school. I'm not smart enough. I had a lot of these very downer thoughts, and went into therapy. And lo and behold, the psychologist questioned if I had ADHD. And sure enough, after I got some testing done in medical school, I discovered that I had inattentive type ADHD. So for anybody else out there that thinks just because you do well in school means you can't have ADHD, that's absolutely not true. So I found out about this late in life. I was an adult in medical school, and that kind of piqued my interest into these kinds of things that affect children. I became a pediatrician first. And then, if I'm to be completely honest, the reason I left pediatrics is because I just didn't tolerate having to deliver horrible bad news to parents. And so I changed, and I went back to school and started studying psychiatry and child psychiatry in particular. And I landed at Brown University in Providence, Rhode Island, which happens to be the home of Ritalin. That's where Ritalin was discovered. And so Brown was on the cutting edge of ADHD research, ADHD medications and treatment. And so I got introduced to ADHD in a very passionate way, simply because of the program I got accepted into.
Very cool. So are there any misconceptions about ADHD? And maybe you can describe ADHD for our listeners who may only know some of the common stereotypes associated with ADHD.
Sure. The first thing I need to say, the difficult thing about ADHD is that final D, that stands for disorder. It's such an ugly word, and so many of our other diagnoses don't carry a word like that, but we're stuck with it. And ADHD, the way I try to explain it to people now, is it is just a different brain. Your brain is wired differently. It doesn't mean you're broken. It doesn't mean you're necessarily defective, but it does mean that you're wired in a uniquely different way that will affect the way the major functions of the brain operate. And those major functions are known as your executive functions. That's stuff like, how well do you prioritize? how well are you able to start a task? How well are you able to stick with a task? How good are you at self-reflection and to use those thoughts to your advantage? So the executive functions are what challenge people with ADHD because their brains develop a little bit more slowly, or certain parts of the brain don't develop really fully until later in adulthood, if at all. And so ADHD is a condition that affects how our executive functions work. So that's how I explain it to folks.
Okay. So ADHD, children, adults, some people aren't diagnosed until later in life. Is there a difference between ADHD in children and ADHD in adults?
Well, that's the big question of the day, quite honestly. The DSM criteria, which is how we make psychiatric diagnoses, the DSM criteria for ADHD was written and designed to diagnose children. And that diagnosis still carries the expectation that you must know your symptoms prior to the third grade and have examples prior to the third grade. Well, if you're a boy and you were a person who externalizes your symptoms, by being hyperactive or acting up or being disruptive in class, boys get discovered really early. And so they're diagnosed quite early as children. Girls, on the other hand, for lots and lots of reasons, get missed. One, girls are internalizers. They often daydream quietly rather than be disruptive. The other thing is that girls are culturally taught to behave. Women are treated very differently than men and boys. Boys get a pass. Boys will be boys, but we don't ever say that about girls. Girls, we expect to sit quietly, raise your hand, and behave. And girls are notoriously harder workers in school. So girls sometimes get missed. Then when they get to be adults and they think about ADHD, often they get dismissed because they did okay in school, or they see an old-fashioned physician who's not familiar with ADHD in adults, or they get misdiagnosed 75% of the time as anxiety or major depression when in fact they had ADHD all along. The tragic thing that I'd like for your listeners to know about is that the average age of diagnosis in a woman today is 37 years of age. Wow. That's an average. So that is a lot of suffering, decades and decades of suffering for a lot of women out there. What's exciting about what's happening in ADHD in adults today all stems from social media. The advent of social media has made it possible for people to get access to information outside of the doctor consulting room. And so since 85% of social media is women on Instagram, on YouTube, etc., it is women who are learning about ADHD and starting to scratch their heads and starting to think, maybe I have this too. And I think that is why we see doctors all around the country experiencing an increase in the number of requests for ADHD evaluations. It's also why we have an increase in the utilization of medication. You may remember about a year ago, we had a drug shortage, and that in part is because of so many new patients that were being diagnosed. Awesome. And just to be clear, it's not a fad. It really is because of access to information. That is a new phenomenon is happening that people are finding out about ADHD today.
Yeah. So tell us about this new deck of 50 strategies, your card deck, how this idea came about, what goals did you have in mind when you started developing it, and how it's used.
Sure. Well, I have been asked a number of times to write a book, and I actually started. And then my heart wasn't in it because I know my ADHD pals. They all buy the book. They all plan on reading the book. They have good intentions. And then the book just doesn't get read. And then the person feels bad about not having read the book. I didn't want to be that guy that gave people with ADHD another reason to feel bad about themselves. The other reason I came up with this idea of a deck rather than a book, even if you do read a good book, and you learn a tip here and you learn a tip there, and you take your yellow highlighter and you mark it so that you remember it, the minute you close the book, that tip is out of sight. And for somebody with ADHD, out of sight means out of mind. So that's why I came up with this deck of cards. And cards, it's not a book. If you find a card that you resonate with and you think, wow, this tip would really help me. I have this problem. You can stick that card up on your refrigerator to remember it. You can put it on your computer screen to remember it. You can take a photograph of it and use it as your screensaver on your phone or your laptop, etc. So it's possible now in this interactive way for you to keep the tip that you would like to have in mind to work on that will help your ADHD right there where you can see it. Because if it's in sight, it's in mind. So that was kind of the goal of the deck, was to come up with a fun, interactive, user-friendly way for people to just get the meat. They don't have to read pages and pages and pages. I've literally distilled it down to the tips that will help your ADHD improve, as well as affirmations that'll help you think differently about yourself. And that's really a very important part of this deck. People with ADHD are extremely hard on themselves. A lot of negative self-talk, a lot of blame and doubt. In fact, that doesn't just come from inside of us. There's a recent article that was published that people with ADHD will have received more than 10,000 negative comments about themselves prior to the age of 12. That's a lot of negative comments.
Yeah, it is. So
and if you think about a child that is internalizing that all the time, they grow up with a very negative sense of self and low self-esteem. And sometimes it's really benign things that teachers and parents don't even realize are going to land badly, like, did you remember your book bag? Or how many times do I need to tell you to remember your homework? Or why have you not put on your coat yet? These simple things that just don't seem all that major, they're not critical, right? But to the ADHDer who hears it all day long, all the time, it really lands on them pretty tough.
So the deck is really interesting. And what makes it interesting is the fact that it's 60 cards. So it's not a very large deck. And 10 of those cards deal with the inner workings or how the brain works and processes information. The other 50 cards are kind of like an instructional guide into how to deal with ADHD. And then some of the cards are actually positive affirmations for people with ADHD. And the front of the card has one or two lines on it, and the back of the card explains the front of the card. And what impresses me most about the deck is what impresses me most about how people with ADHD process. You don't have to go in any order, and you can get the whole thing done. So let's focus on that for a second. You can
shuffle through the deck and just see if a card speaks to you for that day, and you think, wow, this is something I'm struggling with right now. Let me work on this. And so you keep that card out. And then when you master that particular tip, stick it back in your deck and shuffle through and find a new one. I have families that do a card a morning. They leave their ADHD deck out on their kitchen table, and together as a family, they'll pull a card and talk about it. I think that's awesome. I have other people who keep the deck by their computer so that they can post it right there on top of their computer screen to remember it all day. But by making it a deck of cards rather than a book, it is interactive and doesn't have to be read in order.
I want to address a taboo with you for a brief second.
Sure.
And this has frustrated both myself and my co-host Leah, because we see a fair amount of people, even in our small concierge practice, who have ADHD. And we find that when they come in and they talk about it, and we're going to have this deck in our office, and we're going to get our patients with ADHD to order it, but we find that medication, psychostimulants, which are used for ADHD, actually promote focus. They help people concentrate. But there seems to be a taboo in society that these meds are bad for you,
Yeah.
when in all actuality, these people cannot function without these medications. How do you address that as a psychiatrist?
Well, Ira, thanks for that, because we do now have some new, exciting, emerging literature. First of all, because the ADHD medicines are controlled, a lot of doctors are honestly a part of the problem. The doctors have, resisted writing for controlled substances because ADHD meds kind of get lumped in with fentanyl and Valium and Xanax and all these other medicines that, in the right circumstances, are helpful, but also have tremendous abuse potential. And ADHD medicines have some abuse potential as well when mishandled. Back in the old days, we also were concerned a great deal about potential side effects of ADHD medicine. So we would tell parents, you can expect weight loss, you can expect the child to not grow as quickly, to maybe be short of stature. We used to take EKGs because we were concerned about heart rhythm disturbances and all of this stuff. A new study has come out that examined 50 years worth of people who have been on ADHD medicine that entire time. So the patients that were studied began their ADHD medicine as children and continued to take it into adulthood. And guess what? Maybe they were short when they were kids, but they caught up, and now they're of normal height. They never developed any rhythm disturbances. Their hearts are fine. And so the new literature that we're seeing is very, very encouraging and promising that these medications are safer than we ever thought. We used to tell people to take drug holidays. Don't take the medicine every day. That's not good for you. That's not true either. Now I tell people take it every day, not just when you're in school or just when you're in work, because your ADHD medicines are going to help you with your household chores. They're going to help you interact with your family and your friends more effectively. And so, I'm a lot more encouraged by the news in terms of safety of these agents than I ever was before. A lot has changed in the last, say, 5 years.
So what kind of results or changes have you seen so far from patients using the cards? Any stories or feedback that really stand out to you?
Well, Leah, I want to first thank my own patients because they are the ones that wrote this deck. I've been in practice now 35 years. And if somebody comes in and tells me about something that they're doing that has really helped them be more successful in managing their ADHD, on my desk, I've got this little notebook, and I used to just scratch it into the notebook at the end of my session so that I could remember it. And then later on, lo and behold, I had an entire notebook full of great ideas that patients had either developed or that I developed with them to help them be successful. And yes, I think they do find it to be really helpful, particularly in the areas of, say, time management. Time management is a real tough one for people with ADHD, and there are some great tips in the box on how to do that more effectively. Number one on the top of my list is this. Every single person with ADHD today probably owns a cell phone, right? We all do. The wonderful thing about a cell phone, a new mobile device, it's a big chunk of neurotypical brain. Your phone does not have ADHD. So you can leverage the technology of your phone to do things for you that your own brain may not do quite so easily. So, for example, when I go to my doctor's office and they give me an appointment, I don't just put that appointment into my phone's calendar. I put the appointment into the phone calendar, and I set not one, but 2 alarms. One alarm reminds me of my appointment the day before. And the second alarm, just in case I forgot, reminds me of the appointment an hour before. And so you can do that yourself every time you get an appointment. And it becomes a kind of habit. And when you develop that habit, you now have an external executive function, if you will. So because your internal executive functions can be challenged, you have to use external structure, external support. And that's where your mobile phone will be a really powerful tool.
And we noticed that the deck has some strategies that it suggests as well. And when I spent some time last evening looking through the deck, there were some great strategies that people might want to try, even if they don't have ADHD. So
Correct.
give us an example of some sample strategies in the deck that you'd like to share with the listeners.
Sure. So one of the challenges of ADHD is impulsivity, right? So that shows up in a few ways. Number one, let's just talk about shopping. You know, people with ADHD have a real problem sometimes shopping. They'll see something on Amazon and they'll click to buy it right away. They'll be in a store and they'll buy something without thinking about whether or not it fits into their budget. So one of the strategies under the self-control section is create obstacles to impulsive behavior. So if you're going shopping and you're going to the grocery store and you're trying to spend $200 and no more, take cash, $200. If you're going to a department store and you know what you want to buy, look up and see how much it costs. Do not take your credit card with you because you'll be tempted to buy other things. If you see something that you want to buy in a store, take a picture of it. Take it home. You don't have to buy it that day. If the next day when you look at the picture, you still want to buy it, that probably means you've given it some thought and that it's a reasonable purchase rather than an impulsive one. You can do the same thing if you're on Amazon and you stumble on something that interests you. Click a quick screenshot and come back and look at it the next day. It's still going to be there. You can buy it tomorrow. So by creating these little obstacles to impulsive behavior, people can make decisions much more thoughtfully. That's just one of the tips.
I like those strategies. Segueing to Amazon. Okay.
Sure.
Let's talk about your deck, ADHDoable.
Yep.
Which is a great catchy name.
Thank you.
Published by Simon & Schuster, I believe.
That's right. Well, Andrew McNeil, and then distributed by Simon & Schuster, but yeah.
Yeah, and it's impressive. We're going to keep it in our office. We're going to use it. How do our listeners get a copy of the deck if they want it?
You know, the easiest way for them to do that is to go onto Amazon and look up the title ADHDoable, ADHDoable, or you can just search by my last name as an author and it will come up if you search for Mandanis. Or it's available anywhere books are sold. So you can go to your favorite bookstore. It could be a large chain store like Barnes & Noble's, or it can be your small local store that may not carry it yet. Just ask for it and they can always order it for you.
That's awesome. We'll definitely have to tell our patients.
Absolutely.
It's great.
I'm impressed with the deck.
Yeah. So if you...
And I'm excited to let you know that I have a second deck that will come out 1 year from now. And that deck is going to be all just for women.
Oh, wow.
Because ADHD really does present differently in people who were born female than it does for men. And so this deck is going to cover what girls experience when they begin to menstruate, how your estrogen and progesterone changes during your first 2 weeks and your last 2 weeks of your menstrual cycle can change your ADHD experience. When estrogen goes up, so does dopamine. So your ADHD gets better. But when estrogen crashes, your ADHD comes back with a vengeance. It's going to cover breastfeeding, pregnancy, perimenopause, menopause, all those things that women with ADHD are talking about right now and experiencing. So I think it's time for us to focus on women because I think for decades, they're the ones that have been forgotten.
That's amazing. That was one of my questions, if you had any future expansion plans. So that's so exciting.
Thank you. Yeah, that's in there. And this hopefully ADHDoable will become a series, Leah. I've already started writing the third one, honestly, and that's going to be for parents. And then there's another one for teachers and coaches that's in the pipeline, and another one for teenagers that's in the pipeline. And I'm very excited about a series of coloring books for elementary school children, where there's an image of, say, a child drinking a glass of water with their medicines, or a child packing their book bag. And then there are talking points on the back of every illustration for the parents to kind of coach the child on a behavior that would be nice to develop during childhood, like drinking water and taking medicines, so that people will continue to do those into adulthood. And exercise is one of the other images, because I'll tell you, if your listeners are interested in improving their ADHD, medicines are not always the first thing I think about. The first thing I think about is aerobic exercise. There is a huge amount of literature that says if you move your body and get your pulse up and make your heart beat a little bit and provide a little bit of extra blood to that prefrontal cortex of your brain, you're going to get more dopamine, more norepinephrine, and it really does benefit your ADHD. So make sure you're including aerobics into your daily routine if you have ADHD. Even if you don't, it's good for you, but it's especially powerful for people with ADHD.
We have time for one more question, and then maybe we'll have you back for another show. But
Sure.
if you could give one piece of advice to families navigating ADHD today, what would that be?
Well, the first thing I think is it's not, you're not broken. ADHD isn't a character flaw. It's a difference in how your brain is wired. And if you start to think about it as a difference in the way your brain is wired, you can be more supportive of your child. You can be more graceful with yourself. You can demonstrate more self-compassion. You can begin to support yourself, support your child, offer ideas that's going to help their life be a little bit easier, because the critical stuff and the judgment stuff, people with ADHD do that to themselves all day long. And so if I can say one thing that is one of the most important things that you can do to improve your ADHD is to not be so critical of yourself and to be more self-accepting. Because if you are criticizing yourself and you're judging yourself and you're beating yourself up every time you forget something and every time you make a mistake, it's going to make your ADHD worse, not better.
Gotcha. Dr. Perry Mandanis, great friend, great psychiatrist. Thank you so much for being on our show this morning.
Hey, thank you guys for having me on. I really appreciate it, and I'm happy to come back.
Okay, can't wait to talk to you again. Have a nice.
And if your viewers do find me on Instagram at perry.nicholas.mandanis, I am very faithful about answering direct messages. So if you have a question about ADHD or whatever, just send me a DM, and I promise I always answer.
That's great. Thank you so much again for being on our show, and thank you,
Bye,
audience,
guys.
for joining
care.
us for another episode of Preserve Health Talks.